So keep in mind, the likelihood of experiencing these impacts and the extent of which they're experienced are tied directly to things like an individual's risk level, which you might know now from the survey you took previously. Again, if you haven't already, please go back and complete it. So, how does weed impact the body? Well, we know from early on that certain types of weed, like cannabis products with high CBD content, can be a pain suppressant. However, weed use can also lead to not so good impacts like reproductive issues, which make it difficult to conceive or get someone pregnant, eating issues like binge eating, and more serious problems on your health and overall well being. Inhaling smoke, for instance, in any form really, can exacerbate things like breathing issues or issues with your lungs, such as leaving you predisposed to experiencing lung cancer. Cannabis is also known to increase blood pressure, meaning if heart or blood pressure problems exist already or run in your family, it can make it worse over time. It also slows down things like your physical reaction time and endurance for those that might be engaging in athletics. Now, let's talk impacts on the brain. First, research shows us that cannabis use, especially frequent or chronic use, can impact someone's ability to do things like hold on to and recall memory, pay attention for sustained periods of time, or take in and apply new information. And these things are important because they're tied to things like academic performance or performance at work. Also, frequent or chronic use can have pretty dramatic and not so good impacts on our mental health. A lot of people might use weed not just for fun, but to cope with things like depression or anxiety. And while it can alleviate symptoms in the immediate, research shows that over time, it can make the presence of anxiety or depressive disorders a lot worse, and even increase your chance of experiencing something like psychosis or being diagnosed with schizophrenia. It also dramatically increases the risk of suicidality, especially in young adults that are college age. We also know that it has some not so good impacts on our sleep and drastically impacts the brain's ability to adequately rest and repair during our sleep cycles, which impacts your overall sleep quality. Now remember, this information is not geared to scare people away from using cannabis or to make it out to be some sort of boogeyman when it comes to substances. It's just important to provide the context to allow for people to make informed decisions, weigh risk, and reduce harm as much as possible when deciding whether or not weed is for them and how to talk about it. We can't make informed decisions if we can't approach a topic with a holistic and honest view. In the next section, we'll begin to discuss harm reduction strategies to reduce the likelihood and severity of some of these impacts. Obviously, these types of impacts are going to leak into other aspects of life as well. For instance, as an athlete, cannabis use can impair hand-eye coordination and reaction time. It reduces maximum exercise capacity, which means you're at increased risk for fatigue. It reduces motor coordination, balance, tracking ability, and perceptual accuracy, and can decrease strength and endurance overall. Frequent use can also cause coughing, especially when smoked, and frequent respiratory infections. And lastly, it has an impact on your heart rate, meaning it increases it. As use continues or increases, students in academia are more likely to drop out of school or not graduate on time. And that's in part because weed use impairs short term memory, again, decreases your ability to concentrate, can compromise learning skills, impair normal sleep cycles, increases our risks of anxiety and depression, and can lead to things like addiction, which is tied to lower academic and lifetime achievement performance.